Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Which one of the following provides hemodynamic stability and prolonged survival in congestive heart failure? Lisinopril is an ACE inhibitor which prolongs the survival. Which of the following drug is not useful in congestive heart failure? Adrenaline is not useful in congestive heart failure. Digoxin, enalapril and hydrochlorothiazide can be used. Which of the following is not contraindication for use of digoxin? Digoxin contraindications are digoxin cannot be used in acute rheumatic carditis, thyrotoxicosis, and Wolff-Parkinson syndrome. Hypokalemia is actually a contraindication, not the hyperkalemia. Therapeutic plasma level of digoxin is 0.8 to 1.5 nanometers is the plasma level of digoxin. So, therapeutic plasma concentration is 15 to 30 nanogram per ml of digitoxin. For digoxin, it is 0.5 to 1.4 nanogram per ml. Whereas toxic plasma concentration of digitoxin more than 35 nanogram per ml. In digoxin, it is more than 2.5 nanogram per ml.
thank you and thank you for watching.